My name is Caitlin Fiorillo. I'm a physician in the UK ENT clinic. I'm a pediatric ENT, so I see kids from birth to 18 years old, and some a little older. But I manage patients that have any pediatric issue with their airway, breathing, hearing loss, swallowing problems, voice problems, pretty much anything in the head and neck in a child. I really like seeing kids with hearing loss and speech delay to work with them to improve their hearing, whether it be ear tubes, hearing aids, cochlear implants, kind of working them through that whole process. I also particularly like working with kids with voice disorders and swallowing issues to be able to help them manage that. And then any kind of airway or breathing issue, those are all of my passions, working with kids. I like to make it fun for the kids. I know it's never fun to visit the doctor's office, but try to just interact with them and as much as possible. And I think a big important part is listening to the parents. They know their child the best and getting their input and listening to them about what's going on. I think it's great to work at UK because we have so many resources for pediatric patients. As a pediatric ENT, I deal with a lot of complex issues with kids, and being able to have speech pathologists that are trained to work with kids and other pediatric subspecialists in pulmonary and GI, and specifically in the operating room to have the pediatric anesthesiology team and nurses, of course, too, that work with kids is one of the great things about being here. I think one of the most rewarding things is having a patient and family come back after a surgery and the parents say, you know, they're a totally different kid and it's completely changed all of our lives.